Hi, I'm Rick Dancer. Welcome to the Water Cooler. Today we're talking about the proposed budget for Lane County for 2012 and 2013. Just to be real upfront, I am contracted through the county to do these interviews, but we've gotten questions from people around Facebook, from people on the streets, and also from local leaders. Questions that they hear a lot. We're going to talk with Karen Gaffney, who is with the Health and Human Services Department. You're the Assistant Director there. Karen, thanks for joining us.
You bet. Happy to be here.
So Karen, let's start with Health and Human Services. A big chunk of your budget actually comes from federal grants and other sources, right?
That's right. Out of our $113 million department, we get less than $3 million of county general fund.
So let's talk about what that is. What will be actually cut? I know you're cutting 25% like everybody else, but for me, for somebody out on the street, what does that mean? How does that translate into services?
Right. What's happened over the years is that our general fund has been in just the most critical areas for health and safety. So we have general fund in our veteran services, for instance. That's where we provide veterans the opportunity to have an advocate and some support in getting the benefits that they're entitled to. So we run that program. We also have general fund in public health and in our homeless and poverty services.
Okay, so if I'm a vet, what's going to happen? What under this proposed budget, if it passes, what's going to happen to me? What am I going to see different?
Well, what we've had to do to balance our budget is eliminate one of our veteran service officer positions, and those are the people who literally sit down with veterans across the table, go through their service record, figure out what they're entitled to, and help them work through the VA, which is a huge bureaucracy, to get the benefits they're entitled to. Those are medical benefits, other benefits that actually translate into dollars in this community. So it means that if you're a veteran, you're going to be waiting weeks longer than you otherwise would have been to get that service, and it might actually delay the effective date of those services too. So
public health, are we going to lose any nurses?
We're trying our best not to lose nurses. As you said, we've managed to piece together money from federal grants and other sources, so we're trying to keep our safety net intact. What we do have to do, though, is deploy some of those nurses in other places. So we'll take some of our public health nurses and put them at our other clinic, and if we have an epidemic, we'll need to pull them back off of those other services to make sure that we meet our prime public health mission.
Now, what about the clinics? Because I know we put a lot of effort into these clinics, and they're very well used. What's going to happen with them?
Well, and the clinics have been one of our strategies over the years to really diversify our funding base so we aren't so dependent on county general fund. All those clinics are going to stay fully staffed. We still have our 4 primary care clinics and our mental health services out there available for the community.
What about homeless folks in our community? Because we're all concerned about that.
We are, and our Human Services Commission has been focused on working with Eugene and Springfield and the county to really provide a safety net in our community for people who are homeless and need other supports in basic needs. And we're having to reduce those services 25%. That means both reducing staff in our office and also reducing contracts to nonprofits in the community that directly provide that.
How many job losses are we talking? Do you know?
In our department, in Health and Human Services, we're trying to keep decreasing those numbers. So right now we're at about 6, but we're doing our best to place people as we can and find other funding.
Okay, now do this, because soon the youth services are going to also, this next budget, they'll be under your department. And before we started this interview, you kind of shocked me by telling me that right now at the Serbu Center, we only have 16 beds available for detention. And under this proposed budget, that goes to what?
We're down to 8.
So 8 beds.
8 beds for a county the size of the state of Connecticut. The only way we can really do that accountability for youth when nothing else has worked is to use our detention beds, and we will only have 8.
And there are the possibility of having 96 out there. We've never used all of them. We've opened 2 of the lobs before, but 32 is what I remember years ago. Right. And we're down to 8.
Well, and the piece about youth services and the Serbu Center, what we do there is really invest in our future. I think about our department as offering a return on investment. So if we can spend a little bit of money at that point, then we can prevent these kids from becoming the adult offenders that really drain the system, both in terms of quality of life and cost in the prison. We know what works. We know how to do it. We just need the resources to be able to really make an impact on those kids.
All right. Karen Gaffney, thank you so much for being with us.